Hello, my name is Chamil Codipilly, and I am a Senior Associate Consultant at the Mayo Clinic in Rochester, Minnesota. I am one of the first co-authors on our manuscript entitled Development of a Deep Learning Model for the Histological Diagnosis of Dysplasia in Barrett's Esophagus. Barrett's esophagus is the only known precursor lesion for esophageal adenocarcinoma, a malignancy with less than 20% 5-year survival. While the risk of malignant progression in Barrett's increases with the development of low and high-grade dysplasia, the histologic diagnosis of dysplasia, especially low-grade dysplasia, is difficult, likely due to the subtlety of pathologic changes and the visual similarities of post-inflammatory regenerative changes. This leads to substantial inter-observer variability amongst pathologists when interpreting low-grade dysplasia. Low-grade dysplasia is then overdiagnosed in the community and is frequently downstaged to non-dysplastic Barrett's by experienced gastrointestinal pathologists. The distinction here is clinically important given the recommendation for considering endoscopic eradication therapies in low-grade dysplasia, as well as the substantially lower progression rates in non-dysplastic Barrett's compared to low-grade dysplasia. As such, there is a critical need to improve diagnostic capabilities for Barrett's dysplasia. Such a tool could avoid the need for slide review by multiple pathologists, assuage unnecessary patient concern, and more accurately help assign endoscopic surveillance and ablative strategies. We therefore aim to develop a fully automated deep learning model to distinguish dysplasia grade between non-dysplastic, low-grade dysplasia, and high-grade dysplasia on whole slide images from a large cohort of digitized Barrett's esophagus histology slides. Our model demonstrated excellent sensitivity and specificity exceeding 80% for the diagnosis of non-dysplastic Barrett's, low-grade dysplasia, and high-grade dysplasia. Furthermore, results exceeded 95% for these values when a two-class dysplasia versus no dysplasia model was trained. This is clinically important as the presence of dysplasia is generally accepted as an indication for endoscopic eradication therapy. Now, there are some limitations that we have highlighted in our manuscript, but I think the most pertinent is the lack of external validation, which is currently underway. We are optimistic that further refinement of the model will enable more accurate and efficient identification of patients appropriate for dysplastic Barrett's esophagus therapies. Thank you.
Hello, my name is Shahriar Faghani, and I'm a postdoc research fellow at Mayo Clinic Artificial Intelligence Lab in Rochester, Minnesota, and one of the first co-author of the manuscript entitled Development of a Deep Learning Model for the Histological Diagnosis of Dysplasia in Barrett's Esophagus. A deep learning algorithm, which are a particular kind of machine learning algorithm, can automatically learn feature representations from data without the need for prior feature engineering by human. Deep learning models can produce consistent results and help clinicians in tough clinical decisions. Deep learning algorithm can be utilized for visual object recognition. The use of convolutional neural networks, or CNN for short, has been reported in the real-time endoscopic diagnosis of Barrett's esophagus dysplasia and other gastrointestinal pathologies. In these studies, we aim to develop a deep learning-based model for diagnosis of grade of dysplasia in Barrett's esophagus using whole slide images. Since the digital pathology slides are huge images with millions of or billions of pixels, and the fact that just a tiny fracture of a whole slide may harbor dysplasia, using off-the-shelf deep learning models that can take limited input size are considerably inefficient due to computational costs and time to analyze the millions of pixels that make up a slide. Further, whole slide level diagnosis based on a combination of models can be more accurate due to the ensemble theorem, which states that multiple independent classifiers or voters offer better performance than a single classifier. Having said that, in order to take advantage of ensemble models and get around the huge size of whole slide images, we developed a two-stage model. In the first step, we have an object detection model which can identify region of interest on whole slide images. In our case, suspicious areas that may contain dysplasia, and perform a first-pass prediction whether the region of interest contains non-dysplastic Barrett's esophagus, low-grade dysplasia, or high-grade dysplasia. In the second step, we utilize a classifier trained on dysplastic patches to enhance the overall diagnostic performance of the model. In other words, we developed an ensemble approach utilizing two distinct deep learning models to sequentially analyze whole slide images. We created an initial object detection model to identify pathologic region of interest and perform first best dysplasia grade prediction on whole slide images using a you only look once, or YOLO model for short. Subsequently, a second CNN-based classifier model was used to increase classification accuracy within the identified region of interest. Since for each region of interest, we got two predictions, one from the YOLO model and one from the classifier model, the results for each whole slide images were organized into a 3x3 matrix, where the first column demonstrates YOLO prediction and the first row displays the classifier's prediction. And the matrix, the diagonal axis, shows the agreement between the object detection and classifier models. We chose the highest grade of dysplasia as agreed upon by both models as the final histological whole slide images histologic prediction. If you're interested for more details, please check out our manuscript. Thanks for your attention.